When's the last time you woke up naturally with a firm erection? Not last week, not last month. And if you sit with that question honestly, maybe you're not entirely sure, because somewhere along the way, the change was so gradual that you stopped noticing, and then you stopped expecting. Today we are going to walk through all of it, the causes, the science, and a realistic 30-day framework for changing what's happening inside your body. Here's the most important thing I need you to hear before we go any further. This isn't aging, it's depletion. And depletion can be fixed. The answer most men receive, when they're willing to bring this up at all, is simply, it's part of getting older, it's normal, it's expected. I understand why that answer gets given. The appointment is short, there's no easy follow-up question. You walk out carrying the same concern you walked in with, plus a quiet resignation on top of it. But that answer is incomplete. And for a significant number of men, it is simply wrong. Most of what drives erection changes in men after 50 is not inevitable. It is a collection of modifiable factors. Things that respond to targeted attention, lifestyle adjustment, and in some cases, appropriate medical support. You have far more influence over this than you have ever been told. That is what today is about. Let me start with the foundation, because understanding the biology changes how you think about everything that follows. An erection is not a simple event. It is a coordinated process. Your vascular system, your nervous system, your hormonal environment, and specific muscles of the pelvic floor all working simultaneously. When those systems communicate well, erections happen naturally, reliably, without conscious effort. When even one of those systems begins to falter, blood flow restricted, hormone signals dimmed, pelvic floor muscles weakened, nervous system under pressure, the coordination breaks down. And the result is exactly what so many men experience after 50. Erections that are softer, less reliable, harder to sustain, or simply absent when they should be present. Here is something I want to anchor firmly before we go into the causes. The penis is not just a sexual organ. It is one of the most precise health monitoring instruments your body has. The blood vessels that supply the erectile tissue are among the smallest in the entire body. Think of your circulatory system as a network of pipes. The arteries feeding the heart are the main lines, wide and resilient. The arteries feeding the penis are the narrowest branches in the network. The thinnest pipes show the effects of pressure, buildup, and years of wear before any other part of the system does. This means erection changes in a man in his 40s or 50s frequently precede cardiovascular disease by several years. Your body is sending you the signal before the larger problem arrives. That is not frightening. That is a gift. Because catching that signal early is where the most powerful intervention happens. That's what we're doing today. Let me walk you through the 6 primary reasons erection quality changes for men after 50. I want to be specific, because vague explanations don't actually help anyone. Cause 1. Blood vessel health. The first and most fundamental factor is what's happening inside the walls of your blood vessels. The inner lining of every blood vessel, called the endothelium, produces a molecule called nitric oxide. Nitric oxide is the key that unlocks blood flow into the erectile tissue. It signals the smooth muscle of the vessel walls to relax, which allows the vessels to dilate and blood to rush in. When nitric oxide production declines, and it does decline with age, with poor diet, with inactivity, with smoking, that signal weakens. The mechanical process of achieving a firm erection becomes harder to initiate and harder to sustain. Here's the analogy I want you to hold on to. Think of old garden hoses left out in the sun for decades. They start out supple and responsive. You press at the end and the flow builds immediately. After years of neglect, they become rigid, brittle, less responsive to pressure changes. The water is still there. The supply hasn't gone anywhere, but the hose itself no longer responds the way it once did. That rigidity, that loss of vascular responsiveness, is what happens to blood vessels with chronic inflammation, elevated blood sugar, and years of a pro-inflammatory diet. And it shows in the narrowest vessels first, yours. Cause 2. Testosterone levels begin declining gradually in men from around age 30, roughly 1 to 2% per year. By the time a man reaches 50, that 20-year accumulation has become genuinely meaningful. Now, before you say, I already had my testosterone checked, and my doctor said everything was fine, let me stop you right there, because this is exactly where most evaluations fall short. When your doctor orders testosterone, they typically measure total testosterone. If that number falls within the reference range, you're told you're normal, case closed. But here's what that test is missing. A significant portion of circulating testosterone is bound to a protein called sex hormone binding globulin, SHBG. Bound testosterone is present in your blood. It is unavailable to your tissues. What your body can actually use is called free testosterone, the unbound, biologically active fraction. And free testosterone can be critically low even when total testosterone looks completely normal. This is a gap I encounter in my practice regularly. Men who've been told they're fine, who walk out with no explanation. When you look at the complete hormonal picture, free testosterone, SHBG, LH, FSH, a very different story often emerges. Testosterone also plays a direct role in nitric oxide production, vascular health, and the maintenance of the erectile tissue itself. When it falls below an optimal range, even within the broad normal reference, every part of the erection process becomes less efficient, quietly, gradually, without announcement. Cause 3. Pelvic floor. Muscle weakness. This is the cause that almost nobody talks about, and it is one of the most treatable. Inside your pelvis, two specific muscles, the ischiocavernosus and the bulbospongiosus, wrap around the base and root of the penis. The ischiocavernosus compresses the erectile tissue to build firmness. The bulbospongiosus compresses the deep penile veins, holding blood inside the erectile tissue so that the erection is sustained rather than lost prematurely. Together, these muscles function like a two-part valve. One fills the pressure, one seals it in place. Think of squeezing a garden hose at the end. The pressure upstream immediately increases. That is what a well-trained pelvic floor does to the blood held inside an erection. When these muscles weaken, with age, with prolonged sitting, with years of never being trained, the seal weakens. Blood fills the erectile tissue as it should. Then it leaves before it should, and the erection softens. What makes this particularly significant is that most men have never been told they have a pelvic floor. We discuss it constantly in women's health. In men's health, it remains almost entirely invisible, and that silence has cost a great many men years of unnecessary confusion. These muscles can be trained. The improvement is measurable, and the research, published in the British Journal of General Practice, shows that men who complete a structured pelvic floor program have a 40% rate of full restoration of erectile function, not improvement, restoration. Cause 4. Metabolic health conditions like insulin resistance, elevated blood sugar, high cholesterol, and abdominal obesity don't just affect the heart and the pancreas. They are among the most powerful suppressors of erection quality in men over 50, and they work through multiple pathways simultaneously. Elevated blood sugar damages the endothelium directly, impairing that same nitric oxide production we discussed in cause 1. Abdominal fat contains an enzyme called aromatase, which converts testosterone into estrogen, actively lowering circulating testosterone levels. High cholesterol contributes to the buildup that stiffens blood vessel walls. And insulin resistance creates a hormonal environment that suppresses the entire system. What's important to understand is that these are not separate problems. They are one interconnected picture. And they are, in a meaningful way, responsive to the same interventions: diet, exercise, sleep, and in some cases, targeted medical support. Cause 5. Sleep. Sleep is the most underestimated factor in this entire conversation, and I find that men are consistently surprised when I explain why. During the later cycles of deep sleep, specifically the slow wave and REM phases that occur in the second half of the night, your body does two critical things. It produces the majority of its daily testosterone, and it sends a series of automatic erections to the erectile tissue, oxygenating and conditioning it so that it stays elastic, healthy, and responsive. This is your body's maintenance cycle. It runs automatically, every night, but only when the sleep reaches the depth it needs to. When sleep is shortened, fragmented, or disrupted by a condition like sleep apnea, which is significantly more common in men over 50 than most men realize, both of these processes are compromised simultaneously. Testosterone production is cut short, the nightly tissue maintenance cycle is interrupted, and the effects compound over months and years. If you snore loudly, if you wake feeling unrefreshed regardless of how many hours you were in bed, or if a partner has ever told you that you stopped breathing during the night, please get evaluated for sleep apnea. Treating it can produce improvements in testosterone levels and erection quality that rival pharmaceutical intervention, because it restores the conditions under which your body was designed to repair itself. Cause 6. Chronic psychological stress. An erection requires the parasympathetic nervous system to be dominant, the rest and connect state. When you are living under sustained stress, your body operates in sympathetic overdrive, fight or flight. In that state, the cardiovascular and neurological resources that erections depend on are being actively diverted to other priorities. Stress and erections are not just incompatible in the moment, they are physiologically in direct competition. Performance anxiety compounds this in a particularly painful way. One difficult experience, whether from fatigue, alcohol, stress, or any number of causes, creates anticipatory worry in the next encounter. That anticipation is itself a stress signal. The erection becomes less reliable, the anxiety deepens, and a self-reinforcing cycle takes hold that can become more powerful than the original physical cause. This is not a weakness. It is a predictable neurological response to a distressing experience, amplified by the culture of silence around men's sexual health. And like every other cycle, it can be interrupted. Understanding the physiology, which is part of what we are doing right now, is itself a piece of that interruption. What most men experience is not one of these factors in isolation. It is a combination, 2, 3, sometimes 4 of them, interacting and amplifying each other. That's why the approach that actually works isn't a single pill or a single change. It is a coordinated response to the full picture, which is exactly what I'm going to give you now. Before I walk you through the 30-day plan, if the kind of honest, evidence-based education we've been doing today is what you've been looking for, please subscribe to this channel. Every week we cover the topics most men never get real answers to in a clinical appointment. That is why this channel exists. Now, let's build your 30 days. Let me give you something concrete. Not vague advice you've already heard, but a week-by-week framework grounded directly in the biology we just walked through. And before anything else, please see a urologist or your primary care physician. I know that conversation can feel uncomfortable. I know it takes something to put these concerns into words in a clinical setting. But that appointment is the foundation everything else builds on. A proper evaluation should include a full hormone panel, total testosterone, free testosterone, SHBG, LH, FSH, alongside blood pressure, fasting blood glucose, HbA1c, cholesterol, and thyroid function. These numbers tell your body's story. That story guides everything that comes next. If sleep apnea is present, treating it is urgent and effective. The improvements can arrive within weeks. If free testosterone is clinically low, there are evidence-based medical options your physician can walk you through. If metabolic risk factors are present, addressing them is both the most urgent and most impactful first lever. There is no dead end in this picture. There is a spectrum of solutions, and a urologist who knows your complete picture can walk you through all of them. Now, here is what you can begin this week, before you even have that appointment. Days 1-7, sleep and movement, the foundation. These 2 changes address more of the 6 causes simultaneously than anything else I could give you. Sleep first. Commit to a consistent bedtime and wake time, the same 7 days a week, including weekends. Aim for 7 to 9 hours. Make your bedroom dark, cool, and quiet. Remove screens from the hour before bed. The blue light signal keeps your nervous system in a state of alertness that directly delays the onset of deep sleep. These aren't preferences. They are the conditions your body needs to run its nightly testosterone production and tissue maintenance cycle. Movement second. Begin 30 minutes of brisk walking every day. Not running, not the gym, just walking, at a pace where you're breathing harder than normal but can still hold a conversation. Aerobic movement at this level directly improves endothelial function, enhances nitric oxide production, reduces systemic inflammation, and improves blood flow to every part of the body, including the erectile tissue. The research on aerobic exercise for erectile function is as robust as the research on any pharmaceutical intervention we use clinically. Days 8 to 21, pelvic floor training. Add pelvic floor training in week 2 and maintain it through the rest of the 30 days. Here's the exact technique. Lie on your back, knees bent, feet flat on the floor, and hip width apart. Let your body fully relax. Jaw, shoulders, abdomen, glutes. Take 2 slow breaths. On the 3rd exhale, gently contract the muscles you would use to stop urination midstream, without squeezing your glutes, without tightening your abdomen, without holding your breath. Feel that upward, inward lift. Hold it for a slow count of 3, then release, slowly, fully, deliberately, for a count of 3. 10 repetitions, 2 to 3 times daily, approximately 3 minutes per session. The release matters as much as the contraction. You are not just building strength, you are building neuromuscular coordination. A muscle that can only tighten and never fully let go creates a different kind of problem. Train both sides of that equation. Within 4 to 6 weeks, most men who perform this consistently report meaningful improvement in erection firmness and sustainability. Clinical research confirms this. 3 minutes a day, done correctly, consistently. Days 15-30, nutrition and resistance training layer. Dietary changes into weeks 3 and 4. Not an overhaul, a targeted upgrade. Reduce the things that most reliably suppress testosterone and impair vascular function. Ultra-processed foods, added sugars, excess alcohol, and refined carbohydrates. Each of these, individually and together, creates the inflammatory, metabolically dysregulated environment in which erection quality deteriorates. Add the things that support recovery. Leafy greens, spinach, arugula, rocket, are among the richest dietary sources of nitrates, which your body converts into nitric oxide, the same molecule that initiates blood flow into the erectile tissue. Eggs, quality lean protein, nuts, and seeds support testosterone synthesis. Zinc-rich foods, pumpkin seeds, legumes, shellfish, play a direct role in the hormonal production pathway. Add 2 to 3 resistance training sessions per week. You do not need to become an athlete. Compound movements, squats, deadlifts, rows, pressing movements, have the strongest evidence for supporting testosterone levels in aging men. Stress the muscles under load, consistently, over time. That stimulus is one of the most potent natural testosterone signals the body responds to. Throughout all 30 days, the nervous system stress management is not a soft add-on to this plan. It is physiologically essential, and it needs to be treated with the same seriousness you would give any other medical recommendation. Whether that means working with a therapist, developing a consistent mindfulness practice, spending regular time in nature, or having honest conversations with the people closest to you, actively managing your nervous system changes the hormonal and vascular environment your body operates in. A chronically stressed body is a body that is hormonally suppressed, vascularly constricted, and neurologically primed for anything except an erection. If performance anxiety has become part of your experience, one difficult encounter creating anticipatory fear that makes the next more likely to be difficult. Cognitive behavioral therapy and sex therapy have genuine, evidence-backed clinical effectiveness for this pattern. The cycle can be interrupted, and understanding its physiology, as you now do, is the first step. What 30 days actually looks like. By the end of this month, most men who commit to this framework report something real. Not a dramatic overnight transformation, but a genuine felt sense of momentum. Sleep improving, energy returning, morning erections becoming more consistent, the body responding to finally being given what it needs. I've watched it happen for thousands of men who came to me convinced that something was permanently lost, men who left with a plan grounded in biology, not hope, and who came back changed, not from a single intervention, from showing up consistently every day for 30 days. I believe you will see it happen too. I want to speak to this directly, because the threshold for seeking care often feels far higher than it needs to be. If you've noticed a meaningful change in erection quality, not occasional difficulty, but a consistent pattern, that is worth a real conversation with a urologist. Not because something is necessarily frightening, but because your body is sending you a signal, and you deserve to understand what it's saying, specifically and completely. The men who do best are not the ones who wait until something feels like a crisis. They are the ones who come in with curiosity rather than alarm, who say, honestly, I've noticed a change and I want to understand it. A proper evaluation is not intimidating, it is a conversation, relevant blood work, an examination, focused questions about sleep, stress, lifestyle, and medication. From all of that, a clear picture emerges, and with that picture comes a path forward grounded in your actual biology, not in general reassurance. Please don't let embarrassment be the reason you delay. I promise you, I have had this conversation with thousands of men. You are not unusual. You are not alone. And there is nothing here that a good urologist hasn't heard and addressed with genuine care and respect. Before you close this video, I want to ask you something. What have you lost? Not to shame you, but honestly, what does this cost you? In intimacy, in how you feel when you wake up in the morning, in the quiet confidence of being fully present in your own body, in how connected you've been able to be with the people who matter most to you, Because here is what I know from treating thousands of men who have carried exactly this question quietly, sometimes for years. The ones who recover, and most do, are the ones who stopped explaining it away, who chose to listen when their body spoke, who decided that understanding what was happening was worth more than the comfort of not knowing. Getting older is not a failure. The body changes, and I will never minimize that. But change is not the same as decline, and decline is not the same as permanence. The version of yourself that feels vital, present, and fully alive, that version is not as far away as it might seem right now. Make the appointment, begin the walk, do the 3 minutes, take the sleep seriously, talk to someone you trust. I have watched men in their 50s and 60s come back from exactly where you are. I've watched it happen for thousands of men, not through dramatic interventions, but through consistency, through showing up for themselves 30 days at a time. I believe you will see it happen too. If today gave you something real, please subscribe to this channel. Every week we cover the topics most men never receive honest answers to. I've also linked a video above that takes the next step from exactly where we left off today. Take care of yourself, because you are absolutely worth it.